Good morning. I'm doing a quick sound check and we'll be getting started. Peter, can you let me know if you hear me? Sound check? Yep, awesome. All right, well, my name is Rose Hennessy. I am super excited that you've joined us. I know we have some folks that are still coming on. This is our last webinar in a series that we've done. We've done 5 total this year, and I know a bunch of you have joined us for all of them, so I want to thank you in advance for doing that. For today, I've got 10, maybe 15 minutes I'm going to cover, and then we have our guest speaker coming in from Michigan to talk to us. If you have any questions, you can go ahead and put them in the chat or the question box. Either me or Peter Fiala, who's here with me at WCASA, will help answer those. Great. So I'm going to finagle my mouse over here. And I just wanted to show you, because so many of you have taken the time to join us, some of the attendance that we've had on our previous webinars and what those topics were. So the top that says community and societal level prevention is what we're doing today, and we're going backwards chronologically. But as you can see, the live attendees are in orange, and people who have come on to view these things on YouTube are in green. So that link is up at the top. We really encourage you, if you see something that you think looks really great that you wish you would have caught, you can go and check that out. They're all archived. And if you don't have time to chat down that YouTube link, don't worry, I'll send it out in a follow-up email to everyone on this webinar today. Or you could also just go to YouTube and put in WCASA, WCASA. So that asks a good question of what's next, and thinking ahead to next year, we're trying to plan, and for this year we had sent out a survey and we had over 60 of you respond back that these were the topics that you were interested in. That's how we help plan the series, and we're trying to figure out what to do next year and how to model that. So please, keep your eyes open for our survey. We really use that feedback to help plan future events, and we want it to be meaningful for you as well. So just a really quick 101 on logistics. I'm going to grab something I can draw with. Aha. All right, so you will have this wonderful little panel up here that I'm highlighting yellow. You'll be able to raise your hand right here. Can everyone go ahead and raise their hand for me? Click on that button. Peter, are you seeing hands go up? Awesome, great. So if you ever want to be unmuted and you want to say something because you're like, I got to talk about this, I'm passionate, we love that, go ahead and hit that button. Peter, if you can take everyone's hand down. If you would like to chat, you can go ahead and do that in this bottom box right here. If you could go ahead and say hello, or however you like to say hi, so we can see that you know how to use that chat, that would be great. I see greetings, hello, good stuff. And I know that the way our program is set up that only we can see the responses. I like good day, I'm a fan of that. But when people are writing comments, we'll make sure to copy and paste them out so that you can see the rest of those. Let's see here, other things. I think that sounds good. Raising your hand, asking to be unmuted, typing in the chat. If you ever have any questions, you can send them directly to us. And I know Peter here is a rock star, and I probably can't figure it out. He's doing a rock star hand, but between the two of us, we can work that out. I'm thanking you in advance that we do have a follow-up survey at the end of this that if you could take a few minutes to respond to, we really appreciate that feedback as well. And last but not least, before I introduce our next speaker, we just have 1 or 2 polls to try to get to know who's in our audience today. So I'm going to put the first one up, launch. You should see a question on your screen that says, which state are you joining us from? Because we know this is a Wisconsin and Michigan call. I'll just give you a few more seconds. I see that 71% of folks have voted. And close. And share. There we go. All right, so you should be able to see a panel that shows that right now we have 100% of folks on from Wisconsin. So maybe we'll have some other people joining us. Otherwise, that's great. I'm so happy. That's our target audience, so that's great. And then just one more question, and this is for our guest speaker. What title best describes your position where you're working? You should see some options: prevention education, executive director, other staff from a sexual assault or domestic violence agency, a community partner, or other. So I'll give you a few more seconds. All right. And I'm going to go ahead and close this. Thank you for voting. And share. And you should be able to see that we've got about 37% of folks doing prevention education work, 53% are other staff, and 11% are other. If you put other, could you just real quickly chat to us what your position is or how you would best describe that? All right, so we have someone saying police officer on a college campus. That sounds great. So thank you so much for joining. We're going to go ahead and just take a few seconds. This might take half a minute or a minute or so to transfer screens over and allow me to introduce, there we go, our guest speaker today, Tammy Lemmer. She's the Senior Program Manager with the Michigan Coalition to End Domestic and Sexual Violence. So welcome to Tammy. Thanks so much for joining us, and please look for my email afterwards. Neat. All right, Tammy, so we're going to go ahead and I'm going to change and make you the presenter. And I went ahead and I unmuted you, so if you talk, we should be able to hear you now.
Hi, everybody. Great to be here.
Fantastic.
And I am, sorry, it's a technical glitch. I'm not seeing the slides.
Okay, do you have the slides up on your side? Otherwise, we're welcome to have them up here and advance them, whatever you prefer.
Yeah, if you could advance them, that would be great. Thank you. Sorry about that.
All right. No problem. I'm just going to grab them real quickly. All right, so I'm going to change myself back to presenter, but people will still be able to see you. And as of right now, everyone should be able to see your slides. Tammy, do you see those slides?
I do. Thank you very much.
All right, so you just let me know whenever you'd like to advance.
Sounds great. Well, welcome, everybody. Really happy and excited to be participating in your webinar today. The reason why we asked if there were Michigan and Wisconsin people, I was understanding that we might have a few of our prevention educators from Michigan calling in. Hopefully they didn't mess up the time difference. The time zone is different. But I have been with the Michigan Coalition to End Domestic and Sexual Violence for actually going on 11 years now, and have been working almost entirely in our prevention work during that time. I was originally hired as our original Delta coordinator. And for those of you familiar with the Delta project, it's a CDC-funded initiative that is looking at intimate partner violence primary prevention. But really, the overlap with domestic and sexual violence prevention is something we've embraced for some time here in Michigan. We work very closely with our rape prevention education coordinator through our state health department. We've developed a state-wide prevention plan that addressed both domestic and sexual violence, and really the principles that we're going to be talking about today in terms of looking at the outer levels of the social-ecological model and really looking at what do we need to accomplish for community and societal change. We've been able to apply to both intimate partner violence and sexual violence in Michigan. And collaboratively with the different state coalitions we've worked with across the country as well. So the next slide shows just sort of very generically our objectives for today, basically looking to increase the understanding of how to prevent sexual violence at the community and societal levels of the social ecological model. And I'll be talking a little bit of some definitions, some concepts as they relate to that, SEM as we call it, but also probably of greater interest to you is that second objective in terms of I hope to provide some new ideas for community-based initiatives for preventing sexual violence at the community and societal level. So if you would like to advance to the next slide. Some very basic concepts. I presume that many of you are familiar with the concept, but just so that you know the definition that I've been working under, we've been working under here in Michigan. Generally that we talk in terms of primary prevention and equating that with social change, in that it's a long-term process requiring change at various levels of the community to prevent sexual violence before it occurs. So basically that's combining that concept of primary prevention is ending the violence before it happens, if you will, or preventing the occurrence, or preventing the first-time occurrence of domestic or sexual violence, and really incorporating with that concept of social change. And I think that really is indicative of what we're trying to talk about today with the outer levels, if you will, because we don't look at this issue as an individualized issue. We don't look at this issue as something that's a problem with a specific individual. Our approach to prevention is that it is a societal level issue, and that our efforts need to incorporate broad-based community change, broad-based social change. So this slide that you're looking at, again, sort of gives that comparison of the primary prevention framework, preventing violence from initially occurring, and comparing that to common or typical intervention-based responses. And kind of looking at historically what a lot of our member programs in Michigan have often done is obviously they're responding to sexual violence. They're serving in that crisis, crisis mode, emergency response mode. But even in their outreach, there has been a need, certainly, to talk about what is sexual violence, what are the definitions, what does it look like, what are the impacts on individuals, communities, and societies. Highlighting the extent of the problem, meaning the need for statistics, the need for data, police reports, service provider reports, etc. And that's critical. That does have to happen. We actually still have individuals. We have communities. We have partners that may not fully understand the impacts, may not fully understand the dynamics, may not fully understand how prevalent this issue still is across all communities. But what we do is we look to build on that basic, what we would call awareness raising, and start to expand those conversations so that we're focused on conditions. And you'll hear me use that word a lot today, the concept of focusing on conditions. The conditions that are supporting sexual violence, the attitudes and beliefs that are condoning or accepting or minimizing sexual violence, and that really has an impact. And then also the shift towards what are the conditions that are going to inhibit. So what are the changes that need to happen so that sexual violence is no longer acceptable, is no longer tolerated, is no longer minimized. And we see the way of doing that is by essentially promoting behaviors we want others to adopt. So not just the don't do this type of messages, but really framing the conversation about respect, about consent, framing the discussion about what do we want to see, what is the model for a healthy, positive, respectful interpersonal relationship. So go ahead and next slide, please. We try to talk about the work that we're doing, and certainly as we're relating it to the work we're doing at the community and societal levels, we really need to talk about culture, and not culture in terms of sort of ethnic diversity or traditions, family life, etc. The culture I mean here is just the environment in which we all live, we learn, we interact with each other. And unfortunately, that culture is one that violence against women occurs. It is not an uncommon thing. It is not an aberration. It is not a rarity. Unfortunately, it is a result, violence against women is a result of a culture that has condoned and historically accepted sexual assault and battering. And the next slide, unfortunately, demonstrates how very real that culture is and how pervasive the messages are. They continue to be minimizing of sexual violence. They continue to be victim blaming. They continue to be messages that make it seem like it's an individual bad choice that a person has made. And I'll read these. Catholic official blames sexy, sad kids for priest pedophilia. Definition of victim blaming, literally there. College women, stop getting drunk. That was a recent article that came out from an author from Slate magazine. Again, blaming. If women would just stop drinking, problem solved. But we all, of course, know that that's not the case. Nightmare in Maryville, teen sexual encounter ignites a firestorm against family. What that story is about is someone who did have the courage to come forward, share her story, disclose her sexual assaults, and now the community is unfortunately causing problems for the family. Essentially chased the family out of their hometown because they no longer felt safe being there. Again, these are literally article names or headlines. Teenage girl will forget sex crimes committed against her by former high school softball coach, lawyer claims. So again, minimizing what has happened, minimizing the trauma, really kind of implying that it's not that big a deal. And as we all know, it's dangerous, it's harmful to survivors, and it's a reflection of what we need to do, what we call the CABs, the knowledge, attitudes, behaviors, and beliefs that continue to exist in our communities that we need to change. And without making changes across all levels, we are going to continue to have individuals and communities who have these types of beliefs. So this is a graphic that shows the typical 4 levels of the social-ecological model. And basically, this is a tool that was introduced in the 70s, and it was actually, as I understand it, originated in looking at the issues of child abuse. And certainly there's a lot of crossover and overlap with child abuse, sexual violence, child sexual abuse, etc. And it's still being refined. There's different models out there. There's different organizations who've tweaked it a little bit. But it's intended to give us a framework. And that framework is really saying, how do people learn? How do people internalize? How are people influenced in their day-to-day lives? And generally speaking, we are individuals. We are who we were born to be. Whether that be Caucasian, straight, or gay. Who I am, what my identity is. But we all know, certainly there's more and more emphasis on the recognition that who we are is shaped by our relationships, our family members, our friends, our peers, people who are close to us. But even then, those relationships, our interactions with others, are shaped by the larger community. And by community, we might be talking a neighborhood. We might be talking a school system. We might be talking about a faith community. So basically, it's a larger group of people, often share some aspects of an identity. There are connections, interpersonal connections among individuals, but that community is shaped by specific norms. And then the largest area, and again, obviously this nested circle concept reflects that all of these subsets are encompassed or nested within that larger context of society. And society here being, again, really when we start to talk about conditions, we start to talk about norms. What are the rules? What are the laws? What are the larger systematic and structural messages, processes, etc., that are impacting who we are, how things work, how things function, and ultimately narrowing down even to those individual decisions that we make. So for the next slide, just want to talk a little bit about what we would consider community-level risk factors. So really, we're going to be talking about what needs to happen at the community and societal level in order to see change, in order to see true prevention of sexual violence. It's helpful to know what are the conditions, again, what are the situations, what are the realities, what are we trying to face. And these risk factors do come from a set of resources that are available through the Centers for Disease Control and Prevention. Now, in Michigan, I'll give you the disclaimer, we don't often talk about individual or relationship level risk factors. We fear that many of those risk factors could be misinterpreted and used for victim blaming. So again, and I'll cite, the very common, possibly the most common risk factor that's often cited, as was alluded to in the one article, the use of alcohol. And statistically, there are correlations with an individual who has been sexually assaulted and whether or not there was alcohol or another, controlled substance, whether or not there was the existence of that controlled substance at the time of the assault. Now, that's not a causal effect. The research is not saying because that person was drinking that caused the sexual assault. But there's a lot of people who misunderstand that concept, and they think there's a causal effect. They believe that one leads to the other. So again, because of those misconceptions, because of the myths that exist, we certainly are working to address those myths and working to change those beliefs and those attitudes and beliefs. But we try to focus on them at the state level and work with our member agencies and community partners on what are the community level and what are the societal level risks that have a potentially larger impact. And these include poverty, believe it or not, and in terms of, again, it's not a cause and effect. Being poor does not cause someone to perpetrate a sexual assault. But there is information that shows that poverty, when you link it to, as it says on the slide, the concept of male identity, that concept of traditional masculinity, the head of household, the man as powerful, the man as the person who's supposed to be in control, those community factors of not having a job, not having that perceived stature in either the family or the community, that's resonating as a risk factor because a person might be more likely to act out or seek out a means for, quote unquote, reinforcing that identity, reinforcing that status as a powerful male. So similarly, at a community level, we look at what is the response to violence? Now again, we're talking about primary prevention, so our goal is to prevent it from happening in the first place. But we have to recognize that when it does happen, how the individual is responded to impacts a lot of different things. Those of us who work in the movement, we recognize that a person who discloses, if that disclosure does not go well, they're less likely to disclose again, or they're less likely to seek out services because, again, they feel minimized or they don't feel like they've been believed, et cetera. So that lack of institutional support, the lack of appropriate response, is a community level factor because it is creating systems, it's creating attitudes, or it's reinforcing attitudes of this is not an important issue, I'm not an important person, I don't deserve to receive justice, et cetera, et cetera. Again, similarly, when there is a response, whether that be a prosecution, even starting with an arrest or to a prosecution, we know the data, and I'm not a numbers person, I'm more a concept person, so I don't have the data on rates of prosecution versus arrest, et cetera, but we know it's low. The number of reports is low, the number of arrests is low, the number of prosecutions is low, and the number of convictions is low. So all of that contributes, again, to the conditions that's saying this is not a big deal. I can get away with this behavior. It's not considered serious. So when we need to be thinking about, even in terms of primary prevention, the community response has an impact on those attitudes and beliefs. And the last one, again, the general tolerance of sexual assault, the concept that it's not a big deal, the concept that it's a problem that isn't widespread. Those are all community level factors that we need to consider. We really need to get at the heart of in order to achieve the social change that we're striving for. So similarly, the next slide talks a little bit about societal level factors. And they're similar. In fact, there's a lot of the work at both community and societal level looks very similar. There's a lot of parallels to it. So again, you're talking about the social norms, the norms of the broader society that, again, are supportive of sexual violence or condoning of the violence. They support the male superiority and sexual entitlement. Again, weak laws or weak policies, which leads to, as we talked about before, the weak sanctions. And even weak laws and policies related to gender equality. And here in Michigan, work that we're trying to do at those outer levels, we're really starting to use that language about gender equality and using an anti-oppression kind of human rights approach to our work. So that it isn't just about what has happened to an individual person, which we know is horrible, and again, we need to be responding appropriately, we need to be seeking services and providing services, creating access to services for survivors. The bigger picture work that needs to happen is to recognize that this is a gender-based crime, typically, and that in looking at gender, there are many intersections in terms of access to support, access to resources, looking at other forms of oppression such as racism, such as heterosexism. Again, what are those messages in a community? How are they impacting knowledge, attitudes, beliefs, and behaviors about sexual violence? I apologize if you're hearing clunking in the background. We're in an aging building here in Detroit, Michigan, and it sounds like the very dated radiator system just kicked on and is subsequently clunking away in the background, so I apologize. And again, I just want to posit, it's hard. I wish I were able to, see people and hear people and engage level of interaction, but please feel free to raise hands, chat questions, interrupt at any point. And I would also love to hear, as I'm sharing some examples of what's happening here in Michigan, examples that you all have either perhaps tried or thought about or discussed. Maybe you haven't quite gotten to the point where you're implementing anything yet, but it would be great if we could have some sharing going on back and forth at some point. So again, this is the social-ecological model. For anyone who noticed, the other one went left to right. This one goes right to left. I have no idea why. but it's there. This gives you a little more information, again, in terms of the approaches that we take. If we're looking at addressing sexual violence at the individual level, we do tend to look at the knowledge, the information sharing. That's where we start to, and often, unfortunately, end our efforts at more classroom-based programming, or we might be at health fairs. It's really that general awareness raising, information sharing. And again, too often it ends at, here's the data, here's the definition, here's what it looks like. We have been getting better as a movement, I believe, in shifting into more the promotion of the positive behaviors. And that, again, still happens at the individual level, and I would argue doesn't often go far enough. Even when we do start to talk, as it's noted here, talk about life skills, social development, skills, information, knowledge that's going to help an individual person, and then going out to that outer level, or the next outer level of relationship, communication strategies, although I don't think that's the be-all, end-all either, because it's not a communication problem, it's an entitlement problem. As we all know in this movement, people may still say no, and they may feel very comfortable saying no and articulating no, and that hasn't necessarily meant enough to the perpetrator for that behavior to change. But again, this is a model that helps us if we have different kinds of conversations, if we look at parenting and family strategies, if we look at what is the messaging that is being modeled amongst peer groups, among family members. There's an opportunity here for teacher-student relationships, certainly parent-mother-child, parent-child relationships. Start to get a little bit, there's a lot of conversation out there about bystander strategies, which I argue bystander can merge a little bit out to the community level as well. But what we're going to spend the rest of our time talking about today, the purpose of our webinar, is those two outer levels, community and societal. And what we mean by, or the strategies that are impacted at those outer levels, we're really talking about policies, we're talking about procedures, we're talking about systems, we're talking about expectations and processes that are in place that, again, either promote and condone sexual violence or are proactively denouncing sexual violence, and arguably, and certainly importantly, what are they doing to promote and highlight the fact that this is an important issue, that sexual violence is not accepted, it's not tolerated. And again, being more proactive. It's not enough to just have a policy that says sexual harassment's wrong, don't do it, but how is that community or society or institution taking action, being proactive in modeling the positive behaviors, the positive expectations, etc. So the next slide is just a little chart, and we're going to go into much more detail on some examples of a multi-level prevention framework. And we say multi-level because at the core of our primary prevention work in Michigan, and I would argue, many states across the country, certainly the emphasis from the CDC Rape Prevention Education Program has been comprehensive strategies, comprehensive efforts, that recognition that the one and dones are not effective. It's not enough to expect that generations of gender inequality and discrimination against women is going to change after a 30-minute Monday morning assembly, as I like to call them. And even though that we are getting better and we have done a great job of building relationships with schools or youth groups, et cetera, where we are able to come in and do multi-session workshops, and we've developed curriculum, that is still, unfortunately, not enough. It's still, we're really just looking at the individual and relationship, which is a good start. We do have to do that work at that level, but what are we doing to reach those outer levels? What are we doing to change the attitudes, the beliefs, the norms, of these larger groups and the systems that are in place among those groups. And a lot of times even we think in terms of, and the example here, even after an incident has occurred, the example of a Take Back the Night rally. Community activities, that's awareness raising. Again, that's important. That has to happen. There needs to be that public recognition that this is still an issue. But arguably, using awareness events and calling that a community level strategy is really not going to get us to the change we need to accomplish. It is not really viewed as comprehensive social change efforts. So the next slide is a tool that we like to use, and it may be very familiar to many of you, and it's the Spectrum of Prevention, which was a tool developed by the Prevention Institute out of California. The Prevention Institute doesn't just address intimate partner or sexual violence. They address youth violence and other public health issues. And they place this work in the larger context, again, beyond individual behaviors, but really looking to highlight the community and societal factors that influence the issues, including sexual violence. So I like to actually overlay, I wish I could physically show you if I were technologically inclined and had the resources to do this, I would have tried to put the social-ecological nested circles model over a sideways image of the spectrum of prevention. But in lieu of that, I just want to walk people through where I see the overlaps and sort of the information that we've gained from the Prevention Institute and how that informs our work at the outer levels of the social ecology. So if you to the next page, this is actually a screenshot from a publication that is still available. It's actually was published by the National Sexual Violence Resource Center that many of you are probably familiar with. And it's a little guide called Sexual Violence and the Spectrum of Prevention Towards a Community Solution. And I bring up the spectrum of prevention because I feel it does offer us some good examples. And in particular, starting with levels at level 4 and levels 4, 5, and 6, we are really talking about the outer levels, the levels of the social ecology that move beyond individuals, move beyond relationships. And so again, looking at level 4, the concept of fostering coalitions and networks, bringing together groups and individuals. Level 5, changing organizational practices. Again, we're talking regulations, policies, procedures. Those are necessary to help change norms. And then the last level in their model, influencing policies and legislation, again, literally enacting laws, enacting policies that not only say this is unacceptable, but arguably what we're trying to push, and I would argue that it behooves all of us to look at, is what can we be doing that's going to help change those larger conditions? What can we do that's going to change essentially the status of women and address systematic gender inequality issues that exist in our communities? So the next slide, just sort of jumping out at you, fostering coalitions and networks. We all know that, or hopefully, presumably, we recognize that we can't all do this work alone, that it does take community-based partners, and whether those partners are school systems or faith communities or our legislators or even our friends and family, other groups. In Michigan, we're looking, again, from that human rights frame, looking at anti-racism organizations or LGBT equality organizations. Where are the overlaps? Where's the intersection? If there's already a basic understanding of oppression and a basic understanding of the systematic change that's necessary to change those conditions, then we have natural allies. And so encouraging broad community engagement, as this slide describes, is going to increase understanding, bring greater awareness, but it's also going to bring people on board who are going to understand where the overlaps are, understand and recognize that they have a role, that sexism isn't isolated from racism and it isn't isolated from heterosexism, that oppression crosses different identities, crosses different communities, and that in a sort of the it takes a village concept, by looking at this and looking at the overlaps, we have inherent partnerships that are going to be able to support and sustain our efforts. And it brings more people to the table. It can bring greater legitimacy to the issue, that it isn't just those wild man-hating feminists, as we're often described as, but that there's a recognition across different people, different groups, that this is an important issue. And again, that greater involvement, different partners, different voices, a greater level of acknowledgement of the problem is going to ultimately affect public policy. So in Michigan, we've been working closely with lots of different groups that includes teen pregnancy prevention providers, HIV/AIDS organizations, healthcare systems. Again, these are people who interact with survivors often, in some cases every day. They maybe, quote unquote, respond to or address the issue when it occurs, but they haven't always taken the gender-based analysis of what the issue is, or haven't really looked at or examined the root causes in the way that we try to do in our work. But when we have conversations and frame those conversations differently to encourage them to recognize that there is an opportunity for them to do more about the issue, move beyond just, quote unquote, I shouldn't say just, but beyond responding to the violence, but helping them recognize that they have a role in actually helping to change those attitudes and beliefs and conditions, then it's not just us. It doesn't feel like we're alone doing this work. So the next slide does have a little graphic, if you will, about successful collaboration. And these concepts might not be new. If we can move to the next slide, please. There we go. Yep, that's the one. Just, again, it may not be new to folks, but if we're talking about successful strategies at the outer level, that really does inherently mean we need to know how to achieve successful collaboration. And it doesn't just mean reaching out to someone, inviting them to attend a meeting, or it doesn't always just mean asking if they want to co-host an event or sponsor an event. That is positive. Those relationships are good and beneficial. But a true successful collaboration, one that's going to achieve or help move us towards social change, needs to be more comprehensive, more deliberate. And again, it's not just inviting someone to the table, but it is really about building relationships, having a plan, having a shared vision, tapping into recognizing what this shared expertise is. We have our niches. We can't always be the experts in everything, but in that we have expertise in certain areas, we can partner and tie in the important work that we're doing and help those partners understand where it overlaps and, in fact, might help them with their work. For example, we have some partnerships in some of our local communities with our member agencies who work with runaway and homeless youth shelters, for example. Many of those youth who are no longer living at home are on the streets because they do not feel safe in their homes. They have witnessed violence. They have experienced violence. They have been maybe kicked out of their home because of their sexual identity. When they hit the street, they are at higher risk for sexual violence, for substance abuse, for, again, all of these issues that we see in our work. So bringing together those partnerships, recognizing where the overlaps, looking as a team, creating action plans for successful collaboration and shared responsibility in addressing these issues, we're going to be more successful. And the next slide is a wheel, and I apologize that it says batters in the middle, but I personally believe that sexual violence perpetrators fit this same model. But again, it's not just those of us in the sexual violence field or intimate partner violence movement that are working to change beliefs, attitudes, etc. This is something called the Community Accountability Wheel. It was actually, those of you who are familiar with the Power and Control Wheel, developed out of Duluth, Minnesota. We have partners here in Michigan who are actually batterer intervention service providers who helped create this tool in communicating, again, what is that alternative? It's helpful, it's critical to know what the violence looks like, what are the tactics used, etc. But what can we all do about it? What is our role? So this Community Accountability Wheel really highlights different audiences, different groups, different potential partners, if you will, different collaborators, and really spells out what they can do, steps that they can take. And you can see, hopefully, if you can read this on the slide, and I've also made a handout available for Rose to distribute for those who are interested. And if you just Google Community Accountability Wheel, it will come up. But some of the actions, the media will, service providers will, government will. There's language. They're talking about the media will expose and condemn patriarchal privilege. They will cease the glorification of violence against women and children. Those are social change, social norms actions. So again, that's the importance of community collaboration, the importance of we're not in this by ourselves is really critical. So again, I share that even though it was originally developed as an IPV model or tool, I personally believe the steps that can be taken are still applicable in the realm of gender equity, changing norms about violence against women, changing norms against sexual violence. So I hope that's helpful. So then also related to community and societal level change, we're looking at the need to change organizational practices. And what we mean by this, if you want to go to the next slide, what are the what's the culture? What is the expectation within an organization, within an agency, whether that be a nonprofit organization, whether that be a governmental organization, whether that be a for-profit business or corporation? Because those are standards that are being set by those employers. Those standards are what's acceptable, what do we believe in, what are our values as an organization. So if you look at that status or standing of that organization, of that business, those organizational practices, as was pointed out in a Prevent Connect podcast that is, I believe is still available, that you can change practices within an organization. An organization is like a small microcosm of the larger community. So you can make those incremental changes that are achievable. It, as it said here, can be a testing ground, can be tangible and immediate benefits in a smaller microcosm of that larger community or the larger society. So for example, if you, stay on this slide for just another second. If we are talking about sexual harassment policies, again, that seems like a very simple first step, but there are a lot of organizations that have a policy, but it's never discussed. It's never highlighted or promoted. It's something that's in that 20-page operations manual, if you will, or or operating procedures of an organization, but it's not something that's talked about, it's not something that's highlighted. So if you change that organizational practice and you encourage and invite leadership to be proactive, to actively engage in conversation, to not be reactive when an issue of sexual harassment or sexual assault occurs on site, but you are proactive in terms of, again, promoting the behaviors that you believe to be acceptable, promoting the norm about respect, about how you treat your fellow coworkers, then you create that opportunity for those conversations, and those will ideally be transformative in the larger community as well, because those individuals who have access to that information, the culture change of rather than silence or shame or we don't talk about this issue, you're changing that into a culture of we talk about this, this is important, it's unacceptable. So the next slide does talk a little bit about the capacity of an organization. And the reason why I bring this up, and I apologize, it's not centered very well on the slide, that the outer circle talks about step-by-step planning and evaluation tools. The bottom, that might be a little harder to read, principles and values, the value systems that guide the work. That's really what we're talking about. It's values. What are the values of an organization or a community or a society? So in order to be proactive in these issues, people need to be clear, leaders need to be clear about what is acceptable, what are the norms. And everything inside that circle shapes that vision, shapes those norms, shapes those values. So there's resources, there's activities, processes, structures, and a big important word, willingness. There has to be a willingness to engage in these conversations, a willingness to promote norms change, to promote the positive conditions that we're striving for. Yep, good. Next slide. Finally, the top level of the spectrum of prevention, the influencing policy and legislation. And this one is, you can stay on this slide actually. I don't have a separate slide that really talks about examples because policy and legislation is somewhat self-explanatory. It's basically, policy is a set of rules that guide the activities. They guide the activities of government institutions. They guide the activities of individuals and communities. And we talk about the example of opportunity for legislation where we are, fortunately, in a position where sexual assault is technically a crime. There's language on the books, all 50 states, what is considered unacceptable. What we don't have a lot of in our legislation, either at community levels, at state levels, or at the national level, is, again, it's almost that the change in paradigm in talking about prevention, rather than just talking about what is unacceptable, we have an opportunity, potentially, for thinking big picture, to shape legislation that really, again, promotes the positive conditions that we're striving for. And there's language out there at the international level. There's language of that. It's called the Convention on Human Rights. There is an International Violence Against Women Act. There's language in some of those international pieces of policy, if you will, that start to get to gender norms, the importance of gender equity, the conditions that relate to equity. Unfortunately, in the United States, we have not been signatories to many of those international documents. There's a disconnect, unfortunately, with, well, we are the autonomous United States, and we are, are not going to be subject to these quote-unquote random rules and expectations of other countries. And unfortunately, that trickles down to the sense of we're not making that a priority. We are not saying as a country that we inherently believe in gender equity. We do not believe in human rights. And that's not an easy thing for many Americans to hear, or I would argue many don't even think about it in those terms. But again, we have the opportunity to look at norms not only as they relate to gender equity, but other related issues as well. So issues of economic justice, access to resources, access to education, immigration status, educational systems, healthcare systems. Those are big picture issues that can impact our ability to promote gender equity and gender equality. So on the next slide, I want to try to do, it seems like we have a small enough group still of attendees to try to do an activity through the chat. And the point of this exercise is to think in terms of all the steps that would be necessary if we wanted to change the norm in kind of Western, quote-unquote, American culture, that we want to promote hot dogs as a breakfast item. So I'm hoping that in the chat, you could share your thoughts and ideas across all 4 levels of the social ecology. What steps would we need to take if we wanted to promote hot dogs as a, as common as a breakfast item as one might think of pancakes or donuts? So Rose and Peter, if you're able to help me monitor those chats or even chime in verbally. So we'll give people a few seconds to reply.
Hey, Tammy, can you repeat your question one more time? We'll type it in so folks can read it.
So if we were to think in terms of a social change strategy, is that we want to make and promote hot dogs as a quote-unquote typical standard breakfast item. Because that's not a norm. If we think, if you go to any restaurant in America and look at a breakfast menu, you are not going to see a hot dog listed on that menu. So what kind of social change would be necessary? And I would say across all 4 levels of social ecology, but particularly at the outer level, since that's what we're talking about, what steps would be necessary? What changes would we need to see happen in order to have that social norm shift?
Thanks, Tammy. So I know Peter is copying and pasting some of those responses back because the way our program is set up, only we can see them in the chat. I haven't seen anything yet. Maybe if you can copy it and put it into the chat, then folks will be able to see. And
I'd be okay if you just verbally had to read them.
Okay. Yeah, let's go ahead. Oh, so we've got it up. Coming up. Community dollar menu. We have McDonald's breakfast. Get some kids together to eat hot dogs and make a cool TV ad about how good they taste. We would have to get people to believe that hot dogs kickstart your metabolism. We would need to start eating them for breakfast. School breakfast option. Media campaign advertising hot dogs for breakfast. Different breakfast ideas using hot dogs. Marketing for sure, exclamation point. Work with restaurant chains to place hot dogs on a breakfast menu. And discount to employers and schools who serve them to their employees and students. Another one can show that eating hot dogs for breakfast is good for you. Find out how many kids think it's normal to eat hot dogs for breakfast. Celebrity advertisement. Got some good ideas going on. All right, I think I read them all. If I missed someone, I apologize.
Great. If I were in a room with all of you, I would take the next step and kind of chart out where some of these would fall on the social ecological model.
Tammy, if you'd like, we can do that here.
Individual behaviors. What are people eating currently? What do we need for individuals to believe that the idea of the kickstart, sort of tying the health and wellness issue to it. The change in behavior might be motivated by celebrity endorsement or what I would call a champion of the cause. The media coverage, the media campaign, we're starting to inch out a little bit. So the individual choice, so what's healthy for me, what might I want to to have for breakfast. Those are kind of individual level things. Thank you, Rose. Look at this, the use of technology.
Mm-hmm.
The relationship issues, and we start to tie in, okay, well, celebrity so-and-so is doing it. That sounds interesting. Or what are my peers doing? What are my friends eating? Those tend to be, sort of those relationships. What are we seeing others doing? I liked the concept of the discounts as kind of moving into that community level, because that's a structural change. That's a decision. We've engaged that restaurant. We've talked to them. They need to make a change. That's a policy change to decide, A, to put something on your menu, and B, to price it at a point that's going to be more available to a wider audience. School lunches was a great idea. What are the school lunch policies? And we're starting to really get out to the societal level, because we're talking about legislation. The federal government tells us now what our schools can put in their cafeterias, or at least what they're going to get reimbursed for. So there has to be some legislation potentially. There has to be some public policy advocacy to get a hot dog as a quote-unquote approved menu item. So this is a silly little exercise perhaps, but it's meant to show how comprehensive an effort we really need to make to get something accepted on a wide scale. And that it isn't just the media campaigns. It isn't just talking about it. It isn't just documenting how many kids are making those choices, or arguably their parents, their guardians, the adults in their lives, the decisions they're making, because arguably it's mom and dad or grandma who are making those menu purchases. But it's going to take more than just an awareness that, hey, hot dog for breakfast, I never thought about that. It takes more than just conversations and celebrity endorsements to make something happen, but there have to be structural, procedural changes at the business level, at the school level, at the legislative level to make something an option, first of all, and to prioritize that option, and to change the systems and structures to allow that change to occur. So I hope that little analogy is helpful. I should probably pause and see if anybody has any questions or any thoughts about that exercise. You're welcome
You're
to
also
use it, of course. My former colleague who used to work for the Kansas Coalition Against Domestic and Sexual Violence, I believe this was something that she came up with in our early prevention conversations to really reflect on, again, the need to be comprehensive in our efforts. So people might be typing. I will move on to the next slide, which highlights some examples of things that some of our local partners are working on that we're supporting here in Michigan. But again, if anyone raises their hand, Rose, feel free to interrupt or type it into the chat, and I'll be able to glance down at that. But in our last kind of couple minutes here of our time together, this is an approach that we're working on with healthcare systems, and sort of a different way of looking at the role of healthcare providers. Again, we talked about there's a general understanding of the fact that medical care providers certainly see survivors of violence. Some healthcare systems have formalized sexual assault nurse examiner programs. Emergency room staff are sometimes, but not always, equipped to deal with this or to respond appropriately to sexual assault survivors when they appear within their institutions. And we've been doing a lot of work in that area, training healthcare providers, talking about the dynamics of sexual assault. And that work is important. Again, it's understanding the dynamics of sexual assault, understanding and addressing the myths, really trying to change response and avoid victim blaming and to take a trauma-informed approach. That's all critical information that needs to be shared with healthcare providers. And we're doing a lot of important work, I would argue, across the country in that. So our work with healthcare systems in Michigan, actually, we did a lot of work over the last couple of years as part of what's called Project Connect, and that was an Office on Women's Health initiative that is managed by the organization Futures Without Violence. And that's really intentionally bringing domestic and sexual violence service providers and agencies and advocates in partnership, in close partnership with healthcare systems or healthcare providers to not only improve their response to violence, but to really start shifting those norms so that we're creating a climate of prevention, a climate where sexual violence is not minimized, tolerated, or condoned. So at the individual level, individuals are impacted by their access to health care, what information might be available, how are healthcare providers kind of interacting with them. So again, a lot of the work has been related to the response to violence, but to take a prevention frame, we're taking a look at what information is being shared. Is it just the warning signs or those typical risk reduction strategies of you shouldn't be doing this, you shouldn't go out alone, you shouldn't do blah, 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 which again all links back to victim blaming, because if a person had the audacity to do or not do something, then they must have somehow been at fault. Well, we want to shift, and we're encouraging our partners to provide information about healthy relationships and what does a healthy relationship look like, and what is what we call enthusiastic consent, healthy sexuality, promoting those positive norms. And so the relationship level, we get the opportunity to work with healthcare providers in their professional groups, as peers. Again, we're expanding that information and knowledge. It isn't just dynamics. It isn't just about what does violence look like, but what is their role in changing norms, in changing conditions, in promoting respect, and promoting, quote-unquote, healthy, positive relationships and behaviors. So at the community and societal level, we're looking at institutional policies. Again, we do a lot of cross-training. We do a lot of work with healthcare providers, but we're not just limiting that training now to the dynamics or the definitions or the, how to have a trauma-informed response. But we're actually talking in terms of what we call universal education. So what does that mean? When a healthcare provider is talking to a patient, they may be coming in for an annual physical, they might be coming in for an immunization. Who knows what the purpose is? They might be coming in for an injury. They might be coming in for a chronic condition like high blood pressure or, a lot of the other health impacts that we're aware of in terms of that's a result of sexual assault or trauma or violence. So to create an environment where we're lessening the stigma, we're lessening the silence and the shame, to have healthcare providers proactively asking about an individual's relationship, proactively sharing information. For our teen pregnancy providers, we do a lot of work with healthcare, school-based health clinics. They see a lot of young people who, again, depending on the state, depending on the legislation, et cetera, they might be coming in asking for pregnancy tests, or they might be coming in for STD, STI testing. They might be coming in for birth control. In some states, that's allowed. It isn't actually allowed in Michigan for school-based clinics or school-based professionals to share or to provide birth control, but we're allowed to share information about who might provide birth control if that's a question that's being asked by a potential patient. So the point is, when these young people are coming to these school-based health clinics, we're trying to shift that conversation to, unfortunately, we know this happens, how did you get yourself into this situation, or you should know better, or, you're here for another pregnancy test, what's that all about? Well, we've been talking with these healthcare providers, again, about the dynamics of what's called reproductive coercion, that a tactic that the sexual activity might not be consensual. It might be coerced sexual activity, or the activity itself might be consented, but not using birth control might not have been the choice of the partner. So those conversations about birth control, those conversations about reproductive rights as a broader concept, the conversations about individual rights. We actually have institutional policies now that are encouraging those healthcare providers to engage in these conversations. Their screening or intake tools now ask not only did you use birth control, but did you feel comfortable having a conversation with your partner about birth control? So it's a slight change, but it's a change that acknowledges that there might be a discrepancy in the power dynamics of that relationship. Or it might open up the door when someone's coming for maybe emergency contraception. Maybe they haven't disclosed that they were sexually assaulted, whether it be by someone they know or by a stranger. But the healthcare providers now, at least, we're striving to get them to a point where they're recognizing why a person might need or be interested in emergency contraception, that it might not have been their choice even to have the sexual encounter, or if the sexual encounter was consensual, the lack of birth control might not have been. So those changes to the intake policies, the questionnaires, the forms, the information that's being provided, that is structural, that is institutional. Those are policy and procedure changes that need to be implemented and that are being implemented in many communities. And then again, societal level, I mentioned, or I put ACA, the Affordable Care Act, because there is now language in that act that covers, there's mental health implications for sexual assault survivors, there's information. The language is more directed towards domestic violence related issues, but many of us know the use of sexual violence or the occurrence of sexual violence within a domestic violence intimate partner relationship. That is a tactic of that coercion and control. So the fact that healthcare providers are now being encouraged and expected to have these conversations, that's an outer level shift. That's a change in policy, procedure, practice that is opening doors for conversation. It's creating greater attention to gender equity, greater change or opportunities to address where some of the inequities are occurring. And we haven't gotten there yet, but another societal level change, if we start to actually address legislation as it relates to gender equity or discrimination, the opportunities, access to health care, access to reproductive rights, those are all gender equity issues. And when we can start talking with and partnering with what we would consider a single issue organization and have those conversations with them about the overlaps. Again, there's a shared voice, a combined voice, a united voice that might be in a position to move legislation further along than any one of these constituencies might be able to do. So the next example on the next slide is some work that we're doing with educational systems. And this is the area that many of you are probably most familiar with. Again, much of our prevention education efforts tends to be within educational systems, school-based programming, et cetera. There is the Campus Sexual Violence Elimination Act, or it's called the SAVE Act. Some state legislatures have enacted legislation, actually it's often called Aaron's Law. The focus has been actually on child sexual assault survivors and the need for schools to better address and make information available to students about sexual violence, what the resources are, what rights are, et cetera. So those are outer level changes. That's legislation that is happening. I mentioned Title IX as well. We always try to talk about, we hear Title IX talked about in terms of sports equity, but for those of you who may not know, Title IX is really about access to educational opportunities, of which sports is a really important, very fun, very valuable element of a comprehensive educational experience. But it is really about equal access to education. And so we talk about the opportunities to enforce Title IX, the opportunities to make schools, administrators, and arguably more importantly, parents and students, help them know and be aware of the fact that every school in the nation is required to have a Title IX coordinator. Every school in the nation is required to have policies and procedures in place. And again, it's in place to address or respond to sexual violence or harassment, et cetera, gender-based violence in school settings. But by increasing that awareness that the policies are there, that creates an opportunity for us to actually, again, promote the positive. Proactively establish this school community as a place that does not accept violence, it does not accept harassment, etc. So you're creating, by talking about that legislation, talking about the policy that's theoretically on your book somewhere, but it's hidden and no one ever talks about it, no one knows it's there. By proactively talking about it, making it a priority, that's an effort, that's an opportunity rather, to start shifting those norms. Again, this is not a silent issue, it's not a silent epidemic, it's not something that is dismissed or minimized, but rather it is something that is taken very seriously and that the opportunities are there to introduce programming, to talk about policies, to make people aware of what the expectations are. And again, I sort of went backwards on this one, starting with the societal, the legislation, et cetera, but it's the institutional policies that are going to get us to that point. It's the training of staff. Again, everyone in every school in the nation has a Title IX coordinator, but if faculty don't know who that is, if students don't know who that is, they're not even in a position to know that this is an issue that there's a recourse. If something bad were to happen to them, if there's no knowledge about the policy or procedure, then it's not going to do anyone any good. So again, community level where you have staff training on the fact that this policy exists, or an opportunity, maybe you have focus groups or work groups to look at the policy. Maybe it was developed 15 years, or I guess, I don't know, 10 years ago. 10, I guess, 10 or 9, it's 20 years old now, I think. You know, but if that language in your policy dates back 10, 15, 20 years ago, it's probably time to take a look at that. It's probably time to take a look at your language. So it's an opportunity to not only improve response, but it's an opportunity for prevention changes as well, social norms changes as well. So a couple of the very last slide, or not, well, yeah, the last slide I just plunked a couple of other sample strategies, in part because these are things that some of you are probably aware of. Now, purple tie campaign, it could be a teal tie campaign. I just pulled purple tie because one of our member agencies just wrapped up a campaign, and purple is the domestic violence awareness color. You can do the same thing with the teal tie campaign. It's really, it's an engaging men initiative, where again, it sounds individual and relationship, but you can expand these campaigns so that it's not just an individual man saying, I'm standing up, I'm speaking out against domestic violence or sexual violence, which is, again, similar to the White Ribbon campaign. White Ribbon, the men will wear, often will sign a pledge. They're taking a stand, they're speaking out, they're standing up. But I would argue there's an opportunity to expand those. So you're not just doing a public awareness campaign. It isn't just it's not a feel-good activity, and I don't want to minimize, because these campaigns they are beneficial in raising the awareness. But we have an opportunity to move beyond awareness raising. So what do you do with these women the men who've put the white ribbon on or have worn the teal tie? Sure, maybe you get them to sign a pledge. That's great. A pledge, they are pledging to take action. They are pledging to do something proactively. What can you do with that pledge? What can you do to engage other community members? Is that pledge individualized activities or behaviors, or might that pledge tie into, I as a business leader am going to go back to my company and take XYZ action, or I as a government official am going to take action to implement these policies, procedures, etc. So these are examples that are meant to show they start at the individual or relationship level, but they can move to the community and societal level. Red Flag Campaign is something that was a statewide project. I believe it's still ongoing in the state of Virginia. It's sort of as you can understand, a red flag. It's that traditional concept of here's a problem, we need to raise awareness of it. We're naming it, we're highlighting it, but they've actually taken this Red Flag Campaign into faith community audiences, into parenting programs, into fatherhood programs, and they're taking the concept of red flag and actually acting on it, taking action, making sure there's opportunities for change. And then the green dot, ironically, that's meant to turn that red flag concept around. So it's not just highlighting the bad things that are happening or that exist in communities, but Green Dot out of the University of Kentucky is a proactive, they call it a bystander or even an upstander engagement program of these are the good things that are happening on campus. These are the positive actions that are happening on campus. And so while some of it is some of that individual and relationship, there's programming, there's training, there's information, there's knowledge sharing, etc. But they're also expanding their program into the community and societal level because those peer educators, those trained individuals, then take that knowledge, information, resources, and they are speaking to community groups. They might be speaking with the Greek system. They might be engaging with sports teams or the entire athletic department. They might be challenging, and in fact are challenging, university policies and procedures, etc. So again, some of these that start out at the lower level, we're not saying abandon them, but they can be used to jumpstart, if you will, outer level strategies and other types of engagement, with new partners, new systems, and new opportunities to, again, change those conditions. So I think my next slide is just an opportunity for anyone to ask questions. Again, it's hard. I hope that people are still tuned in, that I haven't put anybody to sleep, because I recognize I've kind of been talking at you as opposed to with you, as would be my preference. But hopefully there were some new ideas, or at least if the ideas themselves weren't new ways to implement or approach things that you might already be doing, and that's kind of what we're hoping to have accomplished today.
Hi, Tammy. This is Rose. I unmuted myself, and I can tell you that, yes, we still have people on the line. We're able to follow. I make sure. And that, again, feel free to put something in a chat if you have a question or even just a comment. You can raise your hand to unmute. And while people are thinking, we have about 5 minutes left. I did have a question for you, Tammy. I heard you had mentioned that when folks are signing a pledge, like I'm going to pledge to not commit violence, that instead of just pledging to something like that, they could also go ahead and pledge to say, I might go back and do a training with my staff, or I might go back and do like a policy or something. Could you talk more about that, if there's anyone doing that, or if there are any resources available of what that looks like?
There are a few pledges online. The White Ribbon Campaign, some of their materials seem directed to gender-based violence in general, or violence against women. Some of their materials do seem more focused on and use language as it relates to domestic violence. But I think, again, especially in the prevention realm, when we're changing attitudes and beliefs, I feel comfortable saying that a lot of that is adaptable. And again, it's messages about gender norms. It's messages about how we interact with each other, or how we, tactics that are used to dehumanize or minimize the status of women. So again, whether it's an intimate partner, or who's using power and control in a relationship on an ongoing basis, or it's an individual that's using coercion or force in a sexual encounter, for a sexual assault or a rape. Again, I think the messages, the strategies, the approaches are very similar. So, there are White Ribbon pledges out there. I think, I apologize that I don't have the website in front of me, but again, that's Google being the wonderful thing. They're pretty widely accessible. In one of our communities, it's actually a faith community here in the southern part of the state, in the city of Dearborn, Michigan. We have a very high, large population of Arab American and Muslim individuals, and we have had faith leader pledges, including the clerics, the imams, the religious leaders within the Muslim community, who are taking a look at, again, I don't have it in front of me. I can't remember if we used the term gender equity per se, but they are looking at relationships. They're looking at the status of women. They are looking at the structures that are in place for getting a divorce in the culture, and who has the right to, quote unquote, grant a divorce within that culture, or what are the norms about dating or relationships. I mean, in the Arab, in the Muslim community, they don't typically, quote unquote, date. So to be able to change the norms about how we're discussing relationships, how we're discussing our interactions with each other as men and women, those structural changes, those imams have to pledge to really look at their policies, their practices, their procedures. They're pledging to go back and look at their premarital counseling curriculum, if you will. Again, this isn't just Muslim. We're doing this in Christian communities and other communities.
Mm-hmm.
So again, it sounds like it's more focused on domestic violence, but again, if you're changing the norms about interactions between men and women, if you're changing literally the laws about who can and can take action against someone when you've been harmed or you've been wronged, those religious leaders are making those pledges to go back and look at their systems, look at their policies, look at their procedures, look at their training curriculum, et cetera, or to create one, or to open it. I mean, that's the level where we're at in some communities. They're not even talking about sexual violence. So the fact that they're pledging to go back, and they might have a sermon on sexual violence during a religious service. That's huge for some
That is
religious
huge.
communities. That's breaking the silence. It's breaking the stigma. So it's baby steps, but that's an institutional change that individual faith leader needs to be prepared to start changing that climate at that institutional level or at that community level within that faith community or within that faith system.
Mm-hmm. All right. Well,
I don't know if that answered your question in terms of specific examples. I don't have necessarily pledges, and I would argue you could certainly use some of the pledge models that are out there, but in order for that true collaboration and relationship building, ideally any pledges that you're going to want to create are going to be created collaboratively amongst the individuals who are shaping it to begin with, or who are introducing it to the community. So I would argue it's better to maybe use a template as a model for starting, but again, that true engagement, that true collaboration, that true community involvement is going to come from the joint effort of creating that pledge together.
Wonderful. We are a minute or two over, so I just have 2 comments in the chat that I'm going to read to you, and then we'll call it a day. A comment from Melissa. She says, very informative. Thank you, Tammy. I'm very interested in working more deeply with my community and my society as a whole to promote social change. I'm a DV and SA advocate. However, I do some work in prevention as well with the Child's Trust Fund and a girls group through my agency. I plan on talking with my community partners about this webinar and sharing insight with my Child Abuse and Neglect Prevention Network. And then a comment from Alice that said, very good webinar, very informative, easy to follow. Thank you, Tammy. So with that, thank you so much.
Thank you. And thank you in particular for the person who brought up the child abuse, because again, I think I maybe made one reference to it earlier. Well, actually, it was even in the spectrum of prevention model coming from that field originally. And that's another example, again, and I would argue parenting programs and, fatherhood programs are often meant to be, how to engage parents or fathers, men in particular, in positive, healthy ways. Well, promoting gender equity is a critical way to engage in your family and to be a positive role model for your family, and how you as a man are modeling relationships with women and relationships with the mother of your children. So again, there's a lot of overlaps there with child development work, parenting work, again, fields that are more response-oriented in nature, and also those that are more kind of quote-unquote educational or behavioral change types of organizations. There's so many opportunities, and this work can be so depressing, quite frankly, as we all know, and it's hard work. But when I look at the potential, I look for those partnerships and who are we not yet connecting with. That personally inspires me.
All right. Well, that sounds great. Thank you so much again. Really appreciate your time. Really appreciate everyone coming on. There'll be a follow-up email. If you have any other questions, you can send them to me, and I'm sure Tammy would be happy to work with us further.
Yep, the next slide, if you want to advance it, has my email.
Oh, there's another one. That's exciting. There we go.
I'm always happy to help across the lake.
All right. We'll leave the slide up for a second, but we're going to go ahead and mute everyone, and hope you have a great rest of your week.
Bye, all. Thank you so much. Good luck.